Hello, everyone. Welcome back to the iHealth channel, iHealth Radio, the NBC network, with your one and only host here, Hurricane H. How you doing? Well, I am today. We're just going to be blown away with a super treat. My guest is just going to take us onto a topic that we all need to pay attention to. It is real. It is happening all around us, and it affects our health big time, and probably the health of our generations to come. And but he has solutions, and he has ideas on how to deal with this. Again, I don't want to be too vigorous about my approach, and I always get a little suspense in the first of a show or the start of the show. But without any further ado, I have with me a doctor who really so special, I would say. He is a fellow of the American Academy of Integrative Medicine and American Academy of Medical Acupuncture, as well as advanced fellow in anti-aging, and that's anti-aging, regenerative, and functional medicine. I mean, that's a lot of stuff right there. Is a quadruple board certified functional and regenerative medicine, integrative medicine, physical medicine, and rehabilitation and medical acupuncture. That's quite a bit, as I stated, right? And so, without any further ado, I have with me Dr. David Bilstrom. Doctor, welcome to the show.
Well, it's great to be here.
Listen, we had to make sure that we have you here, and like I said, your work is amazing, and you know, you and I were briefly talking before the show. I've had guests that who had actually experienced, who have experienced autoimmune diseases, and and we've heard those words every now and then. You hear it, on the news. You hear it, new people, but it's always been alluding like, what is it? What's the cause, and so on and so forth. And that's mostly when you get a diagnosis. Most people tell you what you have, but then what was the reason you have it? Usually, that's something that escapes. And in the world of we live in, I mean, it's just happening more often than ever. Plus, I mentioned a few things: regenerative, anti-aging. So all this stuff is things that are very important to anyone watching and listening. I think everyone that's alive should listen because that is really an important part of life. Sorry about that. So, without any further ado, Doctor, I want to just have you tell us a little bit about your background and what got you into this in the first place. I mean, there's a lot of specialties out there.
Yeah, and it's an epidemic, and you're right. Just about everybody has this. When we moved to where we are to start doing the programming about 9 years ago, my wife started meeting other women. Now, 80% of people that get autoimmune disease are women. So here's somebody that grew up in Spain. Here's somebody that grew up in Seattle, Missouri, Pennsylvania. My wife grew up in Wisconsin. All five of them have autoimmune disease. It's like everybody's got it. And there's so many more autoimmune disease now than there used to be. And also, we realized that so many chronic health issues that we didn't think had immune system components actually do, such as heart attacks and strokes and osteoporosis and Alzheimer's and dementia, and even 70% of all autism is one particular autoimmune disease. So, what autoimmune disease is very common, but what it is so the immune system, um, one part of the immune system that is really designed to make sure that we can get rid of anything that's going to hurt us. Anything that's not us that's going to hurt us, this adaptive immune system needs to make antibodies to attack what's going to hurt us and get it out of the body. So, like an infection gets in a bad bug, it's not us, it's just going to hurt us. Well, the immune system should respond by killing that bad bug and getting it out of our system. Kind of like if we get a cold, well, that's a bad bug, a virus that got in. Well, you don't need to have cold for 25 years. It's like, well, you want the immune system to dive in, attack that sucker, get rid of it. I feel okay in 4 to 5 days. If one of our cells turns cancer cell, it's not us anymore, and it's just going to hurt us. The immune system dives in, kills the cancer cell. We didn't even know we had a cancer cell. And this is where multiple times in a lifetime, at least 7 times in a lifetime, we get cancer. But we should get to 90 years of age. We hold up our hand and say, oh, geez, I'm 90. I've never had cancer in my lifetime. But what you're really saying is, on average, I probably had at least 7 times, but my immune system did its work. 1 cell, 2 cell cancer, dive in, kill it. It never got a chance to grow. But autoimmune disease is where that part of the immune system makes antibodies, gets confused. And we actually start making antibodies against our own body parts. And basically, when you're making antibodies against your own body parts, you're basically self-destructing. And kind of a rule of thumb is you never want to attack your own body parts and self-destruct. It's always going to be counterproductive for health if you're self-destructing. So there's very specific things that will get the immune system confused and we start attacking our own body parts. And this could be, the joints like in rheumatoid arthritis. It could be the brain like in multiple sclerosis or autism, or even heart attack or dementia, Alzheimer's, skin, psoriasis, eczema, gut, Crohn's, and ulcerative colitis. Any body part, eyes, uveitis, any body part can be attacked. And so historically, what happens is if somebody gets diagnosed with one of these things, they may ask the question, well, how did I get this? Well, oftentimes the answer has been, well, we have no idea. Well, how can I make it go away? Well, you can't. You're going to be stuck with it forever. And then the only option people are offered are medications that suppress the immune system. And by suppressing the overactive part of the immune system, you ideally are in a position to kind of quiet down the symptoms, the body part that's kind of screaming out in agony, kind of quiet it down. But it's not fixing why you got it. And so it's more of a temporary bandage, and you're not really going to feel great just putting a bandage on something. And because you haven't stopped why you attack one body part, eventually the immune system starts attacking other body parts, second and the third and the fourth. And I can't tell you how many children and teenagers, let alone adults, already have like 4 to 5 autoimmune disease. And because of how these immunosuppressants work, they actually, even though the immune system is disrupted, you have the autoimmune thing, you're much more likely to get cancer, which that's why they kind of talk about cancer being the flip side of the same coin, this autoimmune disease. So you already have this increased risk of cancer. Well, these immunosuppressants actually increase your risk of cancer further. They actually increase your risk of life-threatening infections that no amount of antibiotics can control. And actually, a lot of them has side effects and give you a new autoimmune disease. And so the options that people are given is not the greatest option. But then again, if your body part, whatever it is being attacked so profoundly that you can't even get off the couch, you can't do what you got to do, that you can't put your pants on, take care of your children, get to work, well, you got to do what you got to do to get through your day. And so there's nothing really wrong with these meds. What is wrong, though, is thinking that that's the only option, and then you're destined just to get worse over time and new things. Truly, if you use them, you go, okay, well, I can get through my day now. I don't have as much pain or brain fog or whatever it is, but then it should buy time to go back and do our due diligence to be able to get at the root cause so we can get rid of it. Then you don't even need the medicine anymore. But then you've fixed why you got the first one, and now that's a really great way to stay healthy.
Well, that's quite a bit. We're gonna have to really break it down a little bit, further, because there's few things you stated there, like a few statistics, and one is you mentioned that a great percentage of autoimmune is in women. That's, I think, one of the items that you mentioned that really kind of caught my, you know, uh, time there, because I think that we got to talk about that, especially when you said they're all over the place, and so that means it's not a particular geographic or demographic; it's
Right.
everywhere. So that's one thing, and the other one you did talk about how it is also, you know, in the children, and so that's another big less. I mean, obviously everybody is affected, but specifically you mentioned these two groups, and I mean children, are a mix and they're the future, right? That's the next generation. But if it's happening already, that's a problem. And so
Yes, very much.
the question is, how long has it been happening? Is this something that is fairly new in the last couple of decades, and or if there is a trend, is there a, I guess, trigger to this particular pandemic? I mean, as you said, it is happening, it's real, and is affecting everybody. So let's just go about those points about, like, why is it women specifically, I mean, as the majority, and then definitely why is it increasing in the children, that it's just so month. I mean, it's really big. It's crazy to hear
Yes,
that it's happening. And not only that, that, as you said, it is higher risk to get cancer because of these diseases. I mean, of course, we'll go back to talking about the root causes and why the system gets confused in the first place. So let's just talk about those things, if you don't mind, Doc.
yeah. So, one thing that a lot of people notice is it is so challenging to stay healthy nowadays. You can do just about everything, exercise, I'm trying to eat right, I'm trying to, manage stress, and I still get these things. It's super challenging. Now, one of the main reasons why women get 80% of autoimmune disease is one specific hormone imbalance called estrogen dominance, where you have too much estrogen compared to progesterone. And this estrogen dominance is such a driver of chronic disease in women. I call it the most dangerous disease for women. And if you look at the top 10 reasons why women die, just about almost 90% is tied into this estrogen dominance. That's how profound it is. So estrogen dominance historically drives all hormonal menstrual issues. So things like bad menstrual flows, menstrual cramps, ovarian cysts, polycystic ovarian syndrome, fibroids, endometriosis, breast cysts, fibrocystic breast disease, and even infertility. So anytime you see a woman with any of that hormonal menstrual stuff, you know there's estrogen dominance. But also because estrogen revs and progesterone calms, it causes rev without calm stuff. So if you're a woman and you have excessive worrying or anxiety or panic attacks or you can't sleep, well, that's rev without calm. That's estrogen dominance also. And so just that stuff is so common nowadays. Like historically, a couple generations before, you'd ask a woman, even after menopause, so how was your menstrual cycles, during your reproductive years? Oh, no problem, regular, a little flow, no big deal, 3 days, 4 days, never a problem. Menopause came, I just stopped having my cycles, I was done. Well, nowadays, it's like almost no woman can say that. It's like everybody's got these menstrual irregularities. Nobody just stops their flow one day and is done with menopause. You got the hot flashes and all this. So it's really common. So ideally, when you see that kind of stuff, what we're trying to educate people is that's estrogen dominance. Let's fix it. Let's get that to go away because you don't need any of that stuff. Okay, whether it's the hormonal, menstrual, rev without calm. The problem is if you don't get rid of that, that just keeps pushing you the wrong direction. You get new stuff, including it is a huge disruptor of the immune system, driving 80% of people that get autoimmune disease are women, but also it is a humongous driver of cancer. So women with estrogen dominance before menopause have a 5.4 times greater risk of getting breast cancer before menopause. Not double the risk, not triple the risk, but 5.4 times the risk, and a 10 times greater risk of getting malignant cancers, the ones that start one place and metastasize other places, the worst ones, 10 times greater risk of malignant cancers their entire life. So this is where, if you are watching, morning news program and they got the ticker down below and something comes up that would say, oh, we found something that creates twice the risk of breast cancer. You go, oh my gosh, national alert, look at but this is not even 3 times, it's 5.4 times. This is huge. So it's so important to address this early on to get rid of all the classic stuff before it ever gets there, kind of a thing. And unfortunately, the way we usually take care of this stuff, so like women with really bad menstrual stuff, usually they're given oral birth control pills. They basically put them into menopause. You don't have your flows, you don't have the cramps because you don't have flows and cramps in menopause. So that's kind of problematic, but basically oral birth control pills are estrogen based. So we're actually making the estrogen dominance worse by giving them extra estrogen. Or it gets so bad they need a hysterectomy, or an ovary comes out because of ovarian cyst. Well, any change in anatomy down there actually makes it worse as well. And so the things we're doing to try to help them with this are actually making it worse and driving them the wrong direction. And so this estrogen dominance is an absolutely huge driver. But then this is part of why, it disrupts the immune system, autoimmune disease and cancer. But then, well, here's the immune system component to heart attacks and strokes and dementia and Alzheimer's and Parkinson's and osteoporosis, which are also huge drivers of chronic disease and death in women as well.
That's pretty scary, Doc. I mean, for women watching, I mean, listen, I have a wife, I have a daughter, I have a mother. I mean, these statistics, are really scary. And
I know my mom had breast cancer. My grandma had breast cancer twice. My mom's sister aunt had breast cancer. Oh my gosh, it's everywhere. And so little was done to try to prevent it rather than, hey,
well,
let's deal with it when it's there, but look, we can actually prevent it.
well, I can tell you. I mean, my ex-wife, my first wife, she passed with breast cancer. So I can tell you. I mean, it's there's no one that probably watching or listening doesn't know someone who has, and I've had friends who had it, and I had family members who had it. I've had family who had uterine, cancer. I mean, there's even well, I mean, for women specifically, but really, it is scary to know that it's potential and it's higher risk. 5.4. It's as you said, it's not double. That's a whole different percentage high that you should not even be at one time. I mean, you're talking about like five times more plus. It
Mhm.
is scary, right? Now, but this estrogen uh, is created in excess, right? Somehow. What's that? I mean, why is that happening? I mean, is there maybe something that is in genetics now? Is it something? I mean, we're basically mutating somehow, in our genes. Is that something? I mean, I'm just curious. I mean, because I think these things are all there's genetics that are involved in these the way our bodies function and hormones and everything. But you said it a couple generations back. Everybody was normal. I mean, you didn't hear about these things. It went cool, couple of days flow, and then you're done. Menopause, I'm good. But not happening in the last few decades. But there's got to be a trigger that changed this. Either our environment may be, implicated here. Is it our food that is implicated, which is also, affected by the environment? And that's one big question. And the other one is, as you said, like the solutions that we have, as you said, let's get birth control pills. As you said, you just recreating, making the problem worse. I mean, it's a patch, but you're almost not you're masking the stuff, but really the source is still there. The problem is not going to go anywhere. It's like
Right.
again, that's like the ostrich effect, right? You just put your head down and it's cool. We're safe, but we're not safe. You're just making sure that you'll get a temporary fix, but the problem will exist and it's just probably going to get worse. And that's the thing. I mean, we all sometimes make that mistake, like it's nothing. I'm just going to let it be, and then by the time you get to a certain point, it's too late. So we don't want that to be too late. But so, Doc, what in your research, in your work, what have you found that is some of the triggers that actually creates this type of excessive, estrogen production or
Yeah.
dominance?
So one of the big ones is we're kind of a society of messed up guts. Everybody's got
I
gastrointestinal
love
stuff,
that.
right? Oh my gosh, like 15% of the world population has irritable bowel syndrome. You know, dumping of loose poop and it's just so. But also then acid reflux and bloating and gas and constipation, all this kind of stuff. It just got messed up guts, and so uh, every cell in our body makes toxic byproducts of metabolism as they do their work. So we got to be able to run our detox pathways, dump toxins into the gut, and then poop them in the toilet. Or with environmental toxins, like you mentioned, oh my gosh, lead, mercury, arsenic, pesticides, herbicides, plastics, flame retardants, those get into our body, terribly toxic to the immune system as well. We got to run our detox pathways, dump them into the gut, and poop them in the toilet. But we have such messed up guts that what happened, and medications will do this, like Motrins and Advils, birth control pills, all these kind of antibiotics will create a leaky gut. And so you hear a leaky gut, the more scientific term is intestinal permeability disorder. So there's things in our intestine, our guts, that need to go in the toilet. That's where the crap goes, right? The toxic crap. There's other things that need to get from our intestinal bloodstream, like vitamins and minerals from our food and proteins and good oils and good fats and all this. Well, the tight junctions that are very tightly packed that only let some things from the gut to the bloodstream and not others gets disrupted. Tight junctions are breached. Things start getting in, including toxins. And so when a woman makes an estrogen, there's two big ones, estradiol and estrone. Um, First time the woman makes it is when they start their menstrual cycles as a teenager. The ovaries make estrogens. Well, the ovaries just don't go, okay, I made estrogen, I'm done the rest of my life. I'm good. I can go on vacation and retire right away. We're like, no, no, no. You got to make new healthy estrogens. But once estrogens have been in our system for a while, they get dinged and they get beat up, and now they're irritating and toxic to the system. You got to run your detox pathways, get them in the gut, poop in the toilet. Well, estrogens are fantastic when they're new and healthy. Like estradiol prevents heart attacks, prevents strokes, keeps away cataracts and macular degeneration and osteoporosis, and they keep away fine lines, wrinkles on the skin, and they keep your gut healthy. Super important. But the old toxic stuff, oh man, does that irritate the system. So what happens though, if you have the right nutrients like B vitamins and eat a lot of cruciferous vegetables, broccoli, cauliflower, kale, you're running your detox pathways perfect. Get them in the gut. But then these toxic old estrogens are reactivated and reabsorbed back into the system. They start building in the system. and you start accumulating all these toxic estrogens. So just that alone can create this estrogen dominance. But oftentimes it's a double whammy where estrogen goes too high, but progesterone goes too low at the same time. And so we also live in an incredibly stressful world. Emotional stress, physical stress, spiritual stress. It's just tons of stress. And so the stress hormone cortisol, they talk about cortisol being the forgotten hormone because everybody forgets about it, but it's actually the only hormone that we would be dead without. We may feel really crummy without thyroid hormone. We may feel crummy without estrogen, all this, but we'd be dead without cortisol. So cortisol is designed to go up, down, up, down, up, down with any kind of emotional stress. Stress is there, it's resolved, it goes away. So kind of like back when we were hunter-gatherer societies, you go out to hunt or to gather. Well, if somebody from another tribe jumps out and wants to kill you, cortisol goes up. Wild animal jumps out and wants to kill you, goes up. Well, then you either get the fight or flight, that fight or flight mode, that life or death mode. Well, if you fight or flight and live to tell the tale, cortisol comes down until the next time. But we live in an incredibly stressful world nowadays that kicks cortisol up and locks it in place. And then when you're locked in the stress mode, the fight or flight mode, super common. Oh, I grind my teeth. Oh, I bite my fingernails. Oh, I pick at my cuticles. I pull my shoulders up. I can't shut my brain off at night to go to sleep. All these kind of things. There are kind of signs of that. Well, eventually you stop making progesterone. It harms this hormone production cascade that involves all the important hormones, estrogens, testosterone, pregnenolone, they call it brain and sleep hormone, DHEA, and also progesterone. But the very first hormone that drops out of this whole bunch is progesterone. So now you got the high estrogen, the low progesterone, the double whammy going. Then you start getting all this stuff going on. And then if you don't fix it right, it just gets worse and worse over time. What's one thing that makes it super common because we got messed up guts and we're stressed to the gills.
Wow. Well, I think, if someone's watching today or listening to this show or anytime, you know, you define basically our core problem. I mean, and I think our core problem is not going to go anywhere unless we do something about it. And I mean, individually or maybe as a society. And obviously, as a society, there's a lot of moving parts. I mean, sometimes there's stress makes money in this world, right? So there's that, and then the food is another part, right? You mentioned the whole list of bad things that are out there, pesticides, all these things that are in lead, mercury, all these. So that stuff is all in the body, right? And we use chemicals on a daily basis everywhere, right? And besides, as you said, the fact of the matter, it looks like all our gut system is not functioning, and therefore the stuff is just messing up with everything else in the body, and the immune system is just going to whack, right? So that's a problem here. Now, you you literally kind of went around the whole concept of like how these things work and where the dominance comes in, but the stressors are not going anywhere. I mean, I think to your point, work is stressful, the news is stressful, and we can't get rid of these things now. And with social media, I think it's gotten worse because you just open up any app and you're like, hours of pushed information that could be right or wrong, but the fact is, it just gets you all too much. We just got through a pandemic, a couple of years back. That's another one. That was big stress, right? The inflation, everything that's around us really is just, to your point, is just kicking and pushing. It is, we're almost like there's no protection, for us at this point from these elements. What we need to do is really finding a better way to manage these things. Now, you mentioned something about eating certain things and the vitamins and the importance of those. Now, let's talk about that, that importance. But before, actually, I do want to go back to you mentioned something. We talked about like the idea of the children, because I mean, you've covered a lot more on the women's situation, but really for children, I think that's a common thing that is happening. And our children are exposed to stressful stuff, and if from a mental perspective, the fact that they're on social media and they see all these things and they get that little high and all the stuff, but they get all these emotions coming in. That's one. We have a high rate of suicide, for example. That's just one thing that's happening through stress level.
So common.
Very common. And then we have this problem of, I call it like my definition of pandemic for food, because our children don't eat regular food anymore. Like I have this problem at home, and I've been dealing with this. My kids are, almost 18 and 17 right now. I mean, my oldest is gone, but I always make a joke about how they're going to destroy the economy because they can't go. The restaurants are going to go out of business because our current, children are basically have a set menu. And I've seen it. I don't care what restaurant you go to. You look at the children in that table, they get in the burger, the fries, the pizza, the nuggets, the mac and cheese. I mean, those are like the or wings. That's kind of like the elements. And most of the stuff is processed. This is not like real cool stuff. I mean, it's just quick fix, type of thing, oil based, whatever. It's not just healthy for you. It's just bad. So you talk about, cutting, destroying the gut. I mean, we're doing a good job early on now. So by the time, we get to an age of, I don't know, 20 plus, 20 or 30, you're already like pretty much you've destroyed your gut. I mean that's how I see it. Am I right? Or am I wrong?
No, no, you're right. But it's also the body is so smart when it comes to healing, and the body's default mode is always to move towards wellness. They're always trying to fix stuff. And so, like I use as an example, if you're walking around the house in bare feet and you kick a chair leg, you're
Oh,
hopping around in terrible toe pain, right? And
uh-huh.
if there's small children, you try not to cuss too much, but you're like, this is terrible pain. Well, inherently, subconsciously, I think most humans would go, oh, it's not going to last. I know my body's going to fix this. I just hop around in pain 2 or 3 minutes, it'll be gone. But then I'll try not to do that again because that really hurt. But when we get these health issues, it's really easy to go, well, that's just how it's going to be. My body's not going to fix it. Of course, I'm stuck with it. So, of course, it's not fixing it. But your body's like, no, 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 no. I fix problems. I know how to fix stuff. I'm trying to fix your issue, but something's gotten in the way. And if you can figure out what that is, and the science is fortunately very clear about what gets in the way of the body being able to fix stuff, you get it out of the way, the body goes, all right, I got you. I'll fix this stuff. And then things resolve and go away. And the body's so good, we always kind of talk about, well, you don't need to be perfect, just kind of perfect enough. So everything you're talking about challenges the body's ability to heal. But the body goes, I can probably deal with that. Well, I could probably deal with that too. If you get enough of it going on, well, you got to make some changes. But the body is so smart. It can deal with toxins. It can deal with crappy food. But if you start getting enough of this and for long enough, then the body just can't keep up with the healing process. And that's when you start getting stuff. But the body, no matter how long you've had something, is raring to go. It's ready. You've had something for 40 years. Your body's like, just give me a chance. I can take care of this. And we really see people like in their 80s who have had things since they're 6 years of age. Within 2 months, the body has it gone away. It's been there for 60 years. It's 80 years. The body goes, hey, I got my opportunity. Bang, it goes away. And so this is where we don't necessarily need to make people perfect, but we just got to go, okay, well, how about you do this a little different, do that a little different? And the body goes, hey, that might be all I need.
Well, first of all, I love that message of hope because I think, there is a light at the end of the tunnel here. And what you stated right now clearly means that we can do this. We can fix these uh, pandemics of new life that we have or new era, right? So we can do these things, and the bodies can respond well. I mean, we hear that the body is resilient and it can take. It's
Mhm.
miraculous. Obviously, it can do a lot of things, but we don't want it to get confused, right? That's really what the autoimmune system, they just get all whacked out because they don't know what the hell's going on. They just keep working and functioning more. So obviously, there's some steps we need to do to maybe mitigate some of these stressors and conditions that we've kind of established to ourselves. And like you said, depends on how long you're in it, the damage can be. Now, it sounds like there's no point of no return. It's just a matter of when you stop, you got to do a certain, shift in lifestyles to make the difference. So you can literally reverse this whole process and get, healthier. And by the way,
Yeah.
in some of the experiences, or at least the guests that I've had, and they all talked about, how they had some autoimmune system issue, they were able to reverse it to a degree by doing certain things and changing their lifestyle. So I know for a fact from, accounts that it happens. But I think for our worldwide audience, let's just talk about like some of the key elements that we need to do. Obviously, eliminating some of the stuff we mentioned, but really like what are the steps that we need to do, besides being aware and like the show and the work you do, and there's hopefully more of this out there to educate people. Because you did mention something that there is protocols out there, but the protocols are masking, as we said, they are just band-aids. But those band-aids also make sense financially and in terms of production and revenue and stuff. So they're gonna exist. So the message of like we can stop everything could be controversial to some of these practices and some of the things out there. So without going political and going tangent here, but I guess you get my drift, and people out listening, they probably got the concept that there is a conflict of like, do we prevent, or do we just kind of cover things because it's easier? Let's just mask the pain, but and then because it's good for business, or let's just kind of cut it out. Because here's the thing: if we cut it out, period, maybe it impacts industries and impacts a lot of different revenue streams for different groups. But the fact of the matter is, irrelevant of how people in these industries would operate, we just have to be aware ourselves individually and make the difference one at a time within ourselves and within our environment or our immediate families. And I think if we take charge of our own health and our own life, it's irrelevant because it's a matter of choice. Nobody's forcing us into getting into these, patches and, band-aids. We can make the difference on our own. So let's talk about how do we kind of start this reverse process. And I know you mentioned something about vitamin D briefly. So let's dive into, because I know that it's a big piece, and it's one of the biggest things. And I know for a fact, from just reading about it and just being a little bit more aware about the importance of vitamin D, that the average person today on earth doesn't have enough vitamin D, or at least in our world, in the US, and I guess the Western, hemisphere, or whatever, the North American side, right? So, and by the way, it depends on where you are in the world. I mean, that can also be, impactful if you don't have enough sun, whatever the case may be. But we are not getting enough of that, and some specific types of vitamin D as well. So let's dive into like some of the things that can convert our gut to become as healthy as it can get, with some nutrients and stuff like that, to reverse this process and maybe reverse aging, as you're an expert in anti-aging as well. And then let's talk also about some of the practices, for example, acupuncture. And I know you have some specialty there. So let's talk about these elements that can really make a difference in people's lives. So someone's watching right now, hopefully, can be like, well, okay, we got solutions. Maybe we can, get this started today. And the scary part is that you mentioned about cancer, and that's like the scary word. I mean, the C word is like the word that nobody wants to hear. Alzheimer's, dementia. Those are things. I mean, listen, my mom is getting at an age now. She's starting to lose her, mental, well, not mental, but her, memory stuff. So
Mhm.
I'm curious as to what we can do to even help at this stage, right? And I know everybody that's watching and listening, you need to pay attention, because at the end of the day, if it's not affecting you, it's going to affect someone in your world, and that's a loved one. So let's talk about that, Doc.
Yeah, so yeah, you touched on a really big one, vitamin D,
Mm-hmm.
and the studies are really clear how important that is. Now, I'm gonna make a couple scientific. So this is how important vitamin D is, but then I'm going to go to why somebody may have all the vitamin D they need, but still don't get the bang for their effort. So to your point, so studies, ideally, you can do a blood test for vitamin D. Simple test, any lab can run it. Ideally, you want to be between 70 and 90. Most people are totally tanked out. We're supposed to make it from sun exposure, but for a variety of reasons, we don't make it very well from sun exposure. Plus, we don't get out in the sun. We should eat foods, ideally, that have high vitamin D content, like oily fishes. We don't do that a whole lot, this kind of stuff. And so, a variety of reasons, we're really super tanked. And so, if a woman gets her vitamin D above 60, even though it's not like closer to 80 like it should, she's automatically decreased her risk of ever getting breast cancer by 82%. She's 82% of the way to never having to deal with breast cancer by doing one thing and not even doing it perfect. If a woman's vitamin D is above 50 during pregnancy, she's decreased the risk of her child ever getting the autoimmune disease multiple sclerosis by 50%, the one that attacks the brain. They did this study out of northern Finland where they took every kid born in northern Finland in 1966. And they said, okay, half you kids, we're going to give you 2,000 IU of vitamin D every day, which is like pixie dust doses. It is such nobody comes close to being therapeutic, optimally therapeutic, but a little bit goes a long way when it's a big thing, including in the younger age. The other half, we don't care. We're not going to have you do it, but we're going to follow you for 31 years, and we don't care what you do after the first year. They saw almost an 80% decreased risk of type 1 diabetes. The diabetes requires insulin pumps, 80% reduction in the risk just by doing that one little thing, first year of life. And oh, by the way, it was so good for the brains of the kids, they never end up getting schizophrenia. And so you go, wow, that impacts so many things. You're not even getting perfect. You're just kind of moving towards perfection. But a super central mechanism that so often gets missed that we teach about, and it's a super central mechanism for just about everything, is on every cell in your body, you have to have a receptor for vitamin D. Just like every cell in your body has a receptor for insulin. So the pancreas makes insulin, insulin attaches to the insulin receptors when they're sensitive, tells the cells what to do, control blood sugar. So people hear things like, well, there's insulin resistance, where the receptors become resistant to insulin. You can have all the insulin in the world, it can't attach into the work, blood sugar goes up, you go to diabetes. Same thing happens to vitamin D receptors. They can become resistant to vitamin D. Turns out the gut's such a central mechanism, there's so many more vitamin D receptors in the gut than any other body part. And when the scientists figured that out, they go, wow, vitamin D must be really important for the gut. Well, it turns out the vitamin D receptor in the gut become resistant to vitamin D. And even if you get your levels of vitamin D up, you may not be able to get the bang for your effort. So these researchers out of the University of Illinois in Chicago, I'll give a little shout out because I went to University of Illinois Med School, they figured out this and they go, wow, if you can fix this, and there's really 3 specific things you got to do, wow, you can get rid of the autoimmune diseases of the gut, like Crohn's and ulcerative colitis. Oh, you can get rid of recurrent C. diff infections or recurrent H. pylori infections that people can't get rid of, antibiotic after antibiotic. But also, this looks like just about the thing you want to do for everything. They listed kind of everything. And 6 months later, they go, wow, if you can fix the gut this way, and what it's basically doing is fixing the intestinal microbiome, building up the good guys in the gut, getting rid of the bad guys, they go, wow, this is a study quoted, quote unquote, a nuclear weapon against metabolic syndrome, which is diabetes, abnormal weight gain, and cholesterol issues. Epidemic of that stuff. Well, it's the vitamin D receptor resistance that drives the insulin resistance. Oh my gosh, you can fix this. Harvard comes out 2 years ago, goes, geez, if you can fix the intestinal microbiome this way, you can treat major depressive disorder. Another psychiatric journal, you do this with the intestinal microbiome, it changes personalities. People become more outgoing and social. It has this impact on brain chemistry. So being able to fix this with basically 3 things that the body makes on its own. One is vitamin D, but the body can't make enough from sun exposure. So vitamin D supplements, probiotics, the good bacteria in the gut, that get all decimated by all the things that mess the gut up. And then something called butyrate, which a lot of people aren't familiar with. So butyrate is something made by the good bacteria in the gut also. It's called a short chain fatty acid. So the good bacteria in our gut make tons of important stuff. Serotonin, the feel good neurotransmitter. GABA, the calming neurotransmitter. Good bacteria in the gut make melatonin, prevents heart attacks, strokes, Alzheimer's, cancer, osteoporosis, in addition to helping us sleep well. So the gut makes this stuff. Well, it turns out these short chain fatty acids, butyrate is probably the biggest one, unbelievably powerful. Butyrate all by itself prevents cancer 5 ways, helps brains recover after stroke, helps kids with cystic fibrosis clear all their lung crap. You combine it with vitamin D and probiotic, it fixes the vitamin D receptor resistance. Oh my gosh, it helps you fix everything. And they're just 3 naturally occurring things. You get them in capsule form, but it is a super central mechanism to what drives not only insulin resistance, but brain stuff and inflammation all over the place. And so often people miss this vitamin D receptor resistance things that is such a driver. Even if you got vitamin D, you're not going to get the bang for your effort, but this is tied into all chronic disease, easily fixed.
So the key here is to really get rid of that resistance by cleaning your system. Just flushing all the stuff where with the right ingredients, and then basically you have the tools to operate correctly.
Yeah, and so this is where that intestinal microbiome, the mix of good bad bugs in the gut, is such a central mechanism for our health. And actually, every body part has its own unique microbiome, the mix of good bad bugs. And so, like the palm of your dominant hand has a different microbiome than the palm of your non-dominant hand. Back of the hand different than palm, elbow crease different than an armpit. Every body part has its unique microbiome. So the disruption of the intestinal microbiome disrupts the microbiome of other body parts, such as the disruption of the breast microbiome drives breast cancer. The disruption of the microbiome within the cells in the pancreas make insulin causes type 1 diabetes. So they always talk about the intestinal microbiome, breast axis, the intestinal microbiome, brain axis, all this kind of stuff. And so if you get that intestinal microbiome just right, by fixing this vitamin D receptor resistance, you're really impacting positively every other body part all at the same time.
Thank you, Doc. So now there's quite a bit of stuff available in the market, right? Supplements, like you said. But are they all effective? Probably not. I mean, we got to be able to look for the right ones, right? Not
Correct.
the light stuff. It has to be the real probiotic, the real, vitamin D. So what is there a recommendation, not necessarily brand, but any particular place where we can get the real ones, and maybe even if we can potentially increase it somehow through exposure to the sun, because again, right now everybody's being told put SPF, I don't know, 100. So
That's right.
you have zero acceptance of any sun rays, right? But obviously that's working against us, but because now you get the scare of skin cancer type of thing, right? But really, is that the real thing, or is that not the real thing? That's not the question of today's show. But the fact is, what can we do, and where can we get really the real resources? I mean, because really that's what it is. Because if we can tackle these three things you mentioned right now, right? That ought
Easily.
to change. That ought, well, yeah. I mean, if we start the right formula immediately, it's not going to take, as you said, it's not going to take long before your body starts really generating all. And by the way, you talked about all the good stuff that our body needs to function properly, really in the gut. And I've heard this many times that our immune system really lives in our gut system. And
Yeah.
so but most of us really put a lot of junk in our body. And you're right, we're flushing out all the good things and destroying these pathways or synapses, whatever, the receptors, and or even the functionality where these good things go into our bloodstream. So where can we potentially get the good stuff, doctor? Or maybe if you have a recommendation.
Yeah, and so there's an event that happened in the state of New York that really is telling. And so the pharmaceutical industry, before they sell a prescription medicine, they have an independent company tested for purity and content. Content is it has in it what's supposed to, and what it has on the label. Purity is it doesn't have anything in it that shouldn't be there, kind of a thing that's not on the label. The supplement nutraceutical industry doesn't have those kind of standards. You could be buying anything. It doesn't matter what it says on the label. It may not have any of that in it. It may have fillers that make it incredibly hard to absorb it, or actually can hurt you. So this guy in New York did this study where he said, okay, I've read about the poor quality of the supplements that are sold in the stores. So I'm going to take them from all these different stores, and I'm going to take them to a lab that'll test and tell me, does it have in it what it says? And his kind of conclusion at the end was, geez, most of this stuff is ground up houseplants. There's like none of the active ingredients in it, right? And so the attorney general in the state of New York was so appalled by this that he put a restraining order and had all supplements taken off all the shelves in all the stores in New York State. And people forgot about it. They came back on, but like one of the spokesmen for one of the company and the companies that they were using are the ones that you go like, oh, yeah, that's a big company. That's even a company that I thought based on their name should have better quality. Spokesmen go, geez, we had no idea that this was going on. And I'm like, oh, you gotta be kidding me. You're selling 1,000 capsules of something for $5 and you claim like, oh my goodness, this doesn't have anything in it. And so that's really sad, and people can do this. And so this is where you may do studies. All these studies will say, well, people that take multivitamins don't get any benefit. And so you shouldn't take multivitamins. Well, I'm looking at that going, well, no, what that says is that multivitamins people take are a bunch of crap. They have nothing in them. So of course you're not going to get any benefit. I'd be like totally amazed if you did get benefit from the stuff you buy over the counter. So what you want to look for, and usually got to get these online, is companies that actually have their products independently tested by outside companies before selling it to the consumer, kind of like the pharmaceutical industry. So they're called pharmaceutical grade supplements, nutraceuticals, and they'll have on the label independently tested by outside company, kind of a thing. And so those are the ones that we that do this kind of work are going to have our patients, because if you're going to take something, you might as well get some benefit from it,
Oh
right?
yeah.
And so if you know where to go, and I talk about this in my book and on my website and other kind of things, like what companies are the good ones and where you can get the stuff that's actually going to give you some benefit. And that is incredibly helpful. But now the thing is that most of the stuff though that you might want to take to feel better usually can be temporary. if you know where to put your effort, like this vitamin D receptor thing with the foundational triad, you fix things, you feel tons better, but now your body takes over and does the work. You don't even need the supplements long term. There's very few things that you might want to that really need to take long term. Usually it's temporary. Your body takes over and does it all by itself. And then you get lifestyle stuff to kind of maintain it. I talk about, staying healthy makes sense. SENSE. So the first S would be stress management. Do your 2 minutes of deep breathing with some kind of stress every day. That's all. It doesn't have to be 30 minutes, just 2 minutes of something, three deep breaths. E is eating. Try to eat more real food versus highly processed foods. And there's nature, getting out in nature or even interacting with nature at all. Home gardening, looking out a window has been shown to actually create calm and help that stress hormone cortisol so profoundly that we have actually a compendium on my website that is like 60 different articles about how nature helps human health and well-being. Profound improvement. The second S is sleep. Trying to maybe turn off the electronics an hour before you go to bed. Maybe do your relaxation before you go to bed. And the last one is E, exercise. And what we found out is really you just got to keep moving, right? You do more aggressive exercise, that's totally cool. But if you keep moving, just get your steps in, for example, like 2,000 steps is profoundly impactful. Do another 600 a day. Wow, is that even more impactful? Yeah, you get the 10,000 in, a hot dog, but it's like, just keep moving, just keep moving. And if you do that, well, that's a great way to stay healthy once you get healthy. When you kind of figure out what you need to get healthy, even though the body is super, super complicated, it's truly super, super logical. So there's such an inherent logic behind this stuff that when you know what logically has to happen, it really helps you figure out, well, this is going to give me the biggest bang for effort. I might even not even need to worry about this other stuff. I'll worry about my kids a little bit, but I'll give them some free reign because if they do this big thing, it probably is going to counter that other thing. And then you get good. And then ideally lifestyle should just keep you healthy.
Well, thank you. I mean, it makes sense. It's really it sounds really as simple as that, and it is. But it takes sometimes listening to something like this, a show, or really doing some research, and or maybe talking to an expert like such as yourself to actually be aware. Because again, we're so conditioned to the regular stuff, and we're always wondering like what's going on. But I think you just fix all the problems if people do apply what you just stated today. Unfortunately, I mean that's easier said than done. But so thank you by the way also for sharing where we can get the resources without having to go one way or the other because I appreciate that. So we keep it nice and people. You heard it, very simple. You got to look for the real ingredients and the real stuff that is high grade, and do the research. You should be able to get plenty, and there are certain shows that we have on the network that talk about like good supplements and things like that. Again, do your research, but find out how much of the potent stuff is in these things because otherwise it's irrelevant. You're just taking gummies or whatever of with sugar. So, it could be just like, candy as opposed to like really getting the stuff that you need.
It may taste good, but it may not have in it what it's supposed to.
Well, they taste like candy, right? I mean, some of these things, I
Uh,
mean, at least the gummies, right? But because some people can, like my kids, for example, they don't do pills, so they like the candy stuff or like the gummy stuff. But you're right, if they're not correctly, founded with the right juice, the right ingredients, they just got more sugar and sweet, and that's it. And they got a nice little, pack for fun. But we don't want that. And certainly it makes a difference to actually, change your system and then get your order, your system, your immune system to just activate on its own eventually. As you said, you don't need to continue supplementing.
right.
You could, just to enhance, but certainly your body's going to do what it's supposed to be designed to do, and it's just going to do it
Exactly.
terrifically with you giving it a restart. I mean, really, that's what we're doing. We just got to kickstart these elements in our body to operate, optimally. Now, one thing I want to go back. So this is just a question I have that I've always wondered about. You know, when back in the days, kids were really breastfed. All
Mhm.
right. So natural and people of course ate, natural. So all the nutrients, that the baby would need to be healthier and grow healthier were there. And they were also breastfed for a couple of years, which was even stronger, time frame. Now, it's just a question I've always had. Is there a hindrance where we use, I guess, canned, whatever formula milk. I'm just as because again, I don't know what's in there. I have my
Mhm.
suspicion that it's not as good as it's supposed to be, and obviously we are not getting what we need to do. Although you read the labels and stuff, it says all the ingredients that you need to have, your must haves as a baby. Is that even maybe it's just me, or is there an actual truth to this or
No.
fact?
And that's where we're seeing a lot of things happen in kids that we didn't see as much before, because the breast milk has a ton of nutrients, which is always important, but also the breast milk has its own microbiome. And the microbiome of breast milk from a woman that delivered a baby premature is different than the breast milk microbiome of a woman who delivered the child term. And that microbiome from the breast milk establishes the healthy microbiome in the child. And without it, you can't establish that. But then the substitute, which would be like cow's milk, dairy proteins, has this profound negative impact on the gut. Really, truly, there's many studies that say, well, you don't want to introduce any cow's milk dairy to a child until after 6 months of age. And if you wait that long, or even 8 months of age, a profound decreased risk of type 1 diabetes and autism and brain related issues like anxiety, depression, bipolar, schizophrenia, all this kind of stuff, because it really disrupts this intestinal microbiome, including the intestinal microbiome of the child actually starts to develop during the pregnancy. The microbiome, intestinal and oral microbiome of the pregnant woman gets to the placenta, establishes a placental microbiome that starts establishing the child's microbiome even before they're born. And then if you're born vaginally, that helps establish a healthier microbiome. If you're born C-section, totally disrupts the intestinal microbiome. Breastfeeding establishes the healthy microbiome. Not breastfeeding doesn't do that. So there's all these things that are supposed to produce this really healthy intestinal microbiome in a child at a very young age to basically prevent everything in childhood. But now that you set the system early, like that little bit of vitamin D first year of life, oh my gosh, it's something so important. You're able to do this, you establish health their entire life, kind of a thing. Now, because we know the science is real clear about this stuff, let's say you didn't have a choice. It was a stressful pregnancy, terribly complicated pregnancy, preeclampsia, stressful delivery, even if it was vaginal. They had, to be in the neonatal intensive care unit. They're premature. Oh boy, we know that's going to whack the system. But the science is so clear, we know exactly what to do to unwhack the system, to compensate for that. And so, like a premature infant's liver doesn't make as much of this thing called TUDCA as a term baby's liver. That's why premature infants get a lot more type 1 diabetes, where you got to use insulin pumps. But it sets the system in a bad way. They're more likely to get type 2 diabetes in their 40s and 50s. Well, we know exactly what does that besides premature birth. Well, here we got a supplement called TUDCA. It's actually made by the liver, just what the body makes to stay healthy. Well, we can give it to somebody in a capsule form, or we see children from 21 time zones worldwide with autoimmune disease, the cutest little kids, 10-month-old kids with a knee the size of a basketball because of rheumatoid arthritis, juvenile rheumatoid arthritis. All these health issues that happen in childhood, well, this TUDCA is a big one to reverse the whole thing. It's made by the liver. Things happen like premature birth, can't make it because the liver is not fully formed until 8 months after we're born, easily dinged when it's not fully formed. Well, we can give it to these at-risk kids and do a huge job of preventing type 1 diabetes and autism and all the brain-related stuff that was just running rampant, like you referred to. Our children's brains are just whack. Well, there's reasons we can unwhack it, and this TUDCA is so great for neuroinflammation. Not only is it tied into all the brain stuff, but they think it's going to be this absolute game changer when it comes to this epidemic of the neurodegenerative diseases like the Parkinson's, Alzheimer's, dementia, Lou Gehrig's. It is so important for that, but it's also the super central mechanism in just about everything that they call the civilization diseases. All these things that are happening so much more now than they used to, whether it's obesity, diabetes, kidney disease, liver disease, cancer, blood pressure, cholesterol, autism, heart attacks and strokes, gut and autoimmune disease, cataracts, retinal disease, all the neurodegenerative stuff are all tied into the liver's inability to make enough of this TUDCA to counterbalance the inflammation, increased inflammation in our cells coming from this kind of toxic world we live in. We know what it does. We have ways to counter it. So even if your lifestyle changes, you can't get your kids to undo a lot of this stuff. You can't get them to eat a broccoli stalk to save their lives. That's okay. You can only do what you do, but we know what happens when that happens, but we know how to counterbalance it with some lovely things that the cutest little kid with a knee the size of a basketball, you break the capsule open, put it in their food, and they eat it, and it turns it around. Fantastic what the body can do.
So, Doc, this is the first time I've heard of this personally, and maybe I'm not the only one. Maybe it's a
It's
surprise.
kind of one that people like the butyrate. People know, oh, I know vitamin D, I know probiotic. The butyrate or TUDCA, they're made by the body parts, just totally natural, no side effects, no necessary. If the body can't make it and we give it the body usually goes, oh my goodness, that feels so good. Kind of a thing.
But you would think that they would be available and we should know about it. But I mean, listen. I've been running this show for 4 years, and this is the first time I'm hearing about this element, right? And I do a lot of research and stuff. Now, imagine if you're not into the world or you're not even looking. This is not something you're going to be close to. And so, thank you for even sharing that. And
Can I share with you how this TUDCA works and why all this civilization
yeah,
stuff starts?
please, yes.
So the world we live in is very kind of a toxic world, very challenging to stay healthy. Well, if you take away the water of the human body, we're 80% protein. So we got some vitamins, some minerals, some fat. We'll be 80% protein. So hormones are proteins and neurotransmitters like serotonin, the feel-good neurotransmitter, that's all protein. Cell walls are protein. Enzymes to turn this into that are protein. We're all a bunch of protein, right? Well, it turns out that the one particular spot in a cell, all our cells, that makes protein called the endoplasmic reticulum, the world we live in creates stress and inflammation right where those proteins are being produced. So this endoplasmic reticulum stress causes misfolding of the proteins during production. So if you misfold a protein during production, it's not the protein anymore. Okay, so this is what drives this epidemic of type 1 diabetes, where so many people need insulin pumps. Type 1 diabetes is a disease, diabetes of kids. Adults get it now. Their pancreas just can't make insulin. Well, what happens is inflammation right here, misfolding of insulin. There's no insulin to control blood sugar. So it's called the misfolding protein response. Well, this TUDCA made by the liver, historically, we've known it as a bile acid. It helps the gut, like digest fats and do other kind of stuff. Turns out this TUDCA is the chaperone molecule. So it chaperones proteins through the production process so they do not get misfolded. And then all these civilization diseases are preventable or reversible, including Harvard published a study 13 years ago in this model of mice that they breed them so that they have all the same genes as humans that tend to get type 1 diabetes that require insulin. They gave the mice a chemical to kill the cells in the pancreas to make insulin, totally killed it, so they have type 1 diabetes. And they got no cells that actually can make insulin. If they gave them TUDCA within 100 days, totally reversed the type 1 diabetes.
Without even the pancreas.
And Harvard kind of said, it's very sad, that they said, well, geez, this is really phenomenal. This might actually change the way we deal with type 1 diabetes and opens up the possibility of actually reversing it once it's there. If this ever became a prescription medicine, we'd really have something. And I'm like, you're not going to use it until it becomes a prescription medicine. And the brand that they use back 13 years ago to do this in mice is available still to this day. It's the one we use on my website. It's the good one. And so here's this misfolding protein response as a central mechanism for all civilizations. It's all the whole gamut that I mentioned, including diabetes and all this kind of stuff. And we know where it comes from, the misfolding protein response, but we know how to reverse it so that we can put people in a position, oh, geez, this runs in my family. Well, there might be more than you in your family that have a hard time making enough of this TUDCA. Well, we can do testing. We can see sort of on a simple blood test, sort of like what's happening. Like, geez, you're not making insulin like you should. Geez, your kidney is not quite as healthy as you should. Geez, you got, insulin resistance. These two tests to look for liver proteins to look and see if you got liver inflammation and they're too high. Well, if they're too low, the liver's not making those important proteins. your liver's probably not making this TUDCA either. So you can see these patterns on the simple blood test. You can run in any lab and kind of really figure out what the body doesn't have and then give it to it. But then you heal it. Even the liver needs this TUDCA to stay healthy. So the liver makes TUDCA for itself. If you got a liver dying of cirrhosis, this TUDCA will turn around. It is so great for liver disease. But then now you got a healthy liver. Well, now the liver makes TUDCA on its own and makes all this other incredible stuff. And you don't even need it long term.
Oh my God. That I mean, I'm listening to you. I mean, really, like, you know, it's like it's all here. It's exists. I mean, it's available. It's not like this is like something of the future. It's been around and we know about it, but it's not enough. There's not enough, I guess, information out there. It's not
Not
enough
common knowledge
education.
yet. It's
It's
not
not coming.
common knowledge. It's in the science and it's been there for a while, but it's
Mm.
not. That's why we want to educate non-medical people just as much as we want to educate medical people. Because, the way the system is now, you really have to educate yourself and you really have to advocate for yourself, but you need the right tools and information because you hate to waste your time doing something you don't need. And if you're going to do something, you might as well do something that's a uber central mechanism so you get a huge bang for your effort.
Well, Doc, I'm gonna hit your site. I'm gonna get all the good stuff from there. I'll start going to work here and preach to the world, right? I mean, frankly, it's amazing. Like, we have we have the accessibility to things, but we just don't know where to go, where to look, and what to look for until you get enlightened by someone who knows what the key elements and the key ingredients. And the one thing that you actually confirmed my theory about the children not getting everything they needed by being raised through formula. And I've always, because I believe in the natural process, and everything that has been designed by nature is actually the right stuff, and anything that's kind of human will always have some deficiency, right? We try, we can do all the best we can, but we're never going to be close to the real thing, right? That's just my opinion. Someone can say, "Well, you're wrong, Hurricane. We are perfect." Well, that's okay. You said it.
Oh
We don't
no,
have to be perfect.
human beings are definitely flawed individuals. I'm flawed. Inherently, humans kind of a tad self-destructive. We make choices that we're like, we should know better, but we're human. What are you going to
Mhm.
do?
Yeah.
But there's things that we can do. Well, that's okay. You don't need to be perfect. That's cool. You can be human. Let's just do this over here to kind of help
And
you stay great despite those kind of flaws.
but I love that, doctor. And that's what you said. You don't have to be perfect. We can get close, and close is plenty. As you said, one little change can reduce your risk for cancer. It can reduce your risk
Big.
for Alzheimer's, for diabetes. And the percentage are like, numbers are like a little bit here and you got a 50% or 80% less, risk. I'll take that. Those are good odds when you think about them, right? But really,
Right.
an advice to people, if you are watching today or listening, let me just be clear. If you haven't had kids yet, maybe it's time for you to think about doing it correctly and go through the full cycle of breastfeeding. And again, we're not going to tell you how you raise your children and how you do it, but maybe you got to look into this and study a little bit. Why you're expecting, and hopefully you can do all the good things so you can prevent all these risks. And again, preventative is everything, right? If you can prevent some of these things, it's always the best way. If not, well, you do know how to fix it as well, even post problem. But you certainly have to reverse it. But it's going to take some time. But you don't want to have damage and things like that can be not irreversible, but it could be just damages that will take tolls on your body and your family, your finances, and all the stuff. So if you can do it right, why not? Just a
And
little advice.
that financial piece is so big. So this is why the free online email course that we have on my website, we're trying to teach people where this stuff comes from and how actually to reverse it themselves. We call it the medical bill detox. Because when you start going down this chronic health issues, oh my gosh, does it sap your funds? It is so expensive. Even if you got insurance, it's like, well, this surgery and this medication that is only covered by this much, and then another one, and another one, and then I got an ER visit, and then I went to the hospital, and I haven't met my deductible, and it's like, oh my gosh, it is terrible. So we're like, well, this is the medical bill detox program. We got to teach you this so that you don't have all those financial terrible things happen because of these health issues. You can actually turn this around yourself as long as you know the logic behind the body, how the body works, and what's going to give you the biggest bang for your effort.
Well, thank you. Like I said, I'm gonna dissect the site, and folks, please feel free to just go in there and just get as much stuff as you can get because it's a access to your health, to your better way, of living. And frankly, I mean, health is wealth, and we hear that line all the time, and it repeats itself over and over.
Mhm.
But it won't happen unless we do it right and take care of business correctly and know what to use for our better, system to operate. And again, the body, as you said, doctor, you know it better than most. It does work phenomenally, and it will change things, and it will operate correctly if you give it the right tools to operate with and remove some of the bad, blockages and things that you just dump. I mean, literally, we treat our, body sometimes as trash, and we just dump stuff in there. And if we can clean all that up, and give it a nice little re restart, whatever you want to call it, I think that's going to significantly make a difference. And then we can go to the 90 age, without the aches and the pains, right? So I know you're
Absolutely.
a big advocate about that. We can literally, say goodbye to aches and pains. And by the way, I can tell you personally, I mean, I'm fairly healthy. I do all the good stuff. But in the last year or so, I've been feeling the aches. I've been feeling the pains. I got the bloating. A lot of things I feel there's a shift in my health, and I'm curious. I'm looking like what's changed in my life, what I need to do. Stress is also higher, so therefore, all these things. When you run a business, sometimes it tends to be a little bit difficult. So all these things actually are true. And I know about those things. I can feel them. I can see an impact on my health. So certainly, I would love to be more, I guess, knowledgeable about these little changes that can make a difference. I'm gonna be the first client here. So as always, I say it. I'm first client of my shows and the information I receive, because that's important. But really, folks, listen. It's your life, it's your family. You want to do the right thing by each and every one, that you love. If you do it right, you're just gonna enjoy them more, and you enjoy your life with them better. And that's really, I mean, and to your point, doctor, you just said it costs a lot of money to be sick. And so, as I've had guests who really say we don't have a healthcare, we have a sick care system. And it costs.
Mhm.
Listen, I'm an insurance guy, right? So that everybody knows that. I've put in 30 years in the insurance space. And we're all about preventative. We pay the bills, and we know, if there is a way to get you as healthy as possible, not to go to the ER or to the emergency room or to the hospitalization level, we would do whatever it takes. And so this is perfect, folks. I mean, even the insurance guys, hey, listen, maybe we can put some of these things in our, formularies and add them up and see if there is an opportunity to help people, stay better. So we don't have to spend all those, extra dollars, and we can be profitable. I mean, and I'm making it as a joke, but really think about it, right? A lot of our healthcare is paid by insurance for the most part. And if we can be preventative and create and be innovative in bringing some more stuff, because listen, I've been with this formula designs and things like that and benefit designs. And, sometimes you want to put something good. And I'll give you an example. We introduced, for example, fitness, in our packages to make sure people are healthier.
Mhm.
They exercise and things like that. Wellness programs, and some benefits, there is vitamins and things like that are covered. So you know what? You add a few more things in there that can make a difference. You can save lives. You can make people healthier and happier, and definitely more retained members. So hey, it's a win-win for all. So we can do our part,
True.
from an insurance space. You know, most of the time we're looked at as the bad guys because we. And by the way, I'm not putting myself as the one that makes those decisions. I'm actually on the front line, so I'm always the one that gets bashed if somebody doesn't get their services. My teams and usually are the ones who actually are presenting these benefits, and sometimes they don't get what they need. They come to us. So I'm always an advocate to make sure that we give the right stuff and people receive what they need to receive and get the care that they need, because we want them to be healthy, because that's the premise. I've enjoyed working in this industry personally, because I felt that we were helping people and making a difference in doing it. Now someone can say, you're full of crap, hurricane, because you guys don't do that. Now maybe there are some instances where the insurance company can be a pain and not pay certain things, and but there's ways around that, and people need to be educated about that. We could talk about those in different shows if you wanted to, and get some experts on that aspect. But really, doctor, from this angle, of can we make a difference? We can, and a lot of people can do the difference. And one of the areas I think that can benefit folks is the people that pay for these services, integrating a few things that can make a difference. I mean, some plans they do acupuncture, and I want to ask you about some of that, and that makes a difference in some people's health. So
Mhm.
let's make that a segue to your acupuncture expertise as well.
Yeah. So originally I was a spinal cord injury rehabilitation doctor. So every one of my patients was paralyzed from the waist down to the neck down. And it's a really challenging population, but it really taught me a lot about the holes and the lack of interventions for people with chronic health issues. Not every health issue can be fixed by a medicine or a surgery. So it's also a population that's very sensitive to medication side effects. And so I was looking for something that could help this population when there's nothing else to help them with his bowel or bladder or neck pain, the spine pain, the muscle pain, and all this kind of stuff that wouldn't have any side effects. And so acupuncture kept popping up as something that could help in a lot of ways, no real side effects. So I decided to train out of UCLA. And at the time I worked for years, I've worked at huge teaching hospitals. Well, I came back and all my rehab partners who also see all these very challenging, chronically ill people, they go, oh, great, we have one more intervention. Well, it works so much better than I ever thought. Within a couple of months, I was seeing 100 people a week, and for everything under the sun. But it really works so well. I'm going, okay, so what else is out there that can help folks with chronic health issues or preventing chronic health issues that I never learned in my traditional training? And oh my gosh, there's just so much stuff. And these kind of things work so much better, and you can use them for things that people might not even think about. So actually, I'm 6 for 6 bringing people out of comas with acupuncture. And 5 times I only took one treatment. 15, they're in a coma in a hospital. Back in the day, they were in the intensive care unit. They couldn't discharge them until they woke up. Well, they took the breathing machine off, the kidney machine, the dialysis machine. They wouldn't wake up there for months. And then somebody thinks, well, geez, what are we going to do? The bill that this is creating being in the ICU for 3 months. Oh my goodness. Hey, isn't there somebody who does acupuncture? Can that do anything? Well, go in there, get the needles in 15 minutes later, 5 times. The people wake up within 15 minutes. Hey, where am I? And then off they go the next day. One time it took 2 treatments, 2 days, 15 minutes each. And so you go, wow, who would have thought acupuncture can do that? I didn't think it could do that until I was trained. And then I was trained at how you can do this. I'm like, well, I'm probably never going to have a chance to do that. Well, I've had a chance 6 times. But these interventions like acupuncture and other things, oh my gosh, all of them basically work by getting the body to fix itself. And the body, it knows how to wake up from a coma. If something got in the way, you get out of the way, the body wakes up from a coma and all this other kind of stuff. And so the acupuncture I found incredibly fascinating. And you go after these central mechanisms. And if you go after the central mechanisms, you can fix everything at the same time. So like with acupuncture, you might get 10 people in for primary complaint is low back pain, but they're all different. One person's got low back pain and insomnia, low back pain and irritable bowel syndrome, low back pain and asthma, low back pain and neck pain. So you can't treat them all the same. And this is where the researchers on acupuncture do a terrible job, because they go, okay, we're going to take 10 people with low back pain, treat them with the exact same acupuncture points. Oh, it only worked for 2 people out of 10. It's not very good. Well, I go, well, of course, that's not how you do it. You got to treat them all different. And if you treat them right, 10 out of 10 get better. So you got people that come in, but it's a very much leap of faith. It's not kind of what we're used to. So people might come in to see me for low back pain, and they go, what are you going to do? And I go, well, I'm going to have you stick your tongue out. I'm going to check your pulse. And I'm going to put some little fine needles in you. And they're like, I don't know if I believe this is going to happen, right? And so we do the first treatment. But we do a history. So here's a person with low back pain, constant 8 out of 10, 5 times a day. It radiates down the right leg, 10 out of 10. The last 20 minutes, oh, it's debilitating. But also they have a hard time falling asleep, and they wake up 5 times a night to pee. And they only poop every 3 days, and all this other kind of stuff. So they come back for the second visit. I say, hey, is anything different? No, all the same. It didn't help at all. I go, okay, so the low back pain still constant. Yep, constant. Still an 8 out of 10 on average. Yep, 8 out of 10. Still go down to like 5 times a day. Yeah, and just as bad as ever. I don't know. So I go, okay, so what about your pooping? Oh my gosh, this is really weird. Usually I poop like every 3 days. I pooped every day this week. Oh, that's really weird. What about your sleeping? You said you wake up like 5, 6 times a night to pee. Oh my gosh, I think I woke up once all week to pee. I slept through the night. Oh my! I go, yep, we nailed it. We got the right points. We hit the central. It's just a matter of time before the back gets better. It's just that your body goes, oh yeah, we want that low back pain to go away. But I got to tell you, the body's saying this. I think it's going to be much more important if we figure out how to sleep, because if we're not sleeping, we can't fix nothing. So I'm going to let it fix the sleep first. And our guts are such a central mechanism. Man, we got to get that good. If you're not pooping every day, you got a bunch of toxic crap sitting in your system. We probably ought to fix that before the back pain too. So the body like picks and chooses what it wants to fix first. They'll get to the low back pain. But then with this kind of medicine that I do, this functional medicine, it was very enticing because it's really getting at the root cause of why you got a health issue. And if you get at the root cause, you're in a position to fix everything at the same time. So people get all these health issues. They got all this stuff going at the same time. Well, it can look very confusing. How can everything sort of be whacked at the same time? It actually makes it super simple. The only way that everything in your system can be whacked at the same time is these central mechanisms we've been talking about. You fix these central mechanisms, everything's in a position to get better at the same time. Now, of course, some things get better than others. Sometimes this thing will lag so far behind, we got to give it special attention. But if it gets better as we're fixing the big picture, we go, well, geez, I'm glad we didn't waste your time giving this special attention. You fixed that by yourself. And so with my experience of acupuncture, this way of looking at the body was so cool, but also it speaks to people because they come in and they go, okay, so how are you going to figure out what's causing all this stuff at the same time? Well, I don't have to tell them, stick your tongue out, let me check your pulse and all this. I say, we're going to do some blood work. Okay, that makes sense to me as far as my understanding of how medicine works. Well, is this something like real special? I said, no, you can get it done in any lab, and I'll use the right diagnostic code so your insurance will pay for it. But we'll figure out exactly what's going on, and then we'll get everything heading in the right direction at the same time. And this really kind of speaks to what people expect in medicine, but also, kind of, we don't need to waste people's time doing stuff they don't need because we can test and pick this stuff out really well.
Wow. Doctor, it's amazing. You've integrated, and again, that's your expertise. You're integrative medicine guru with all these functionalities or functional medicine concept that you use. You're progressive, you're holistic at the same time. You use some, that non-conventional style, I would say, because really, I mean, people do not go to acupuncture. I mean, we know it's more of like, a good example, for example, in our insurance space, some of our packages do have access to acupuncturists and they're geared to certain communities because, for example, in New York, in the New York market, the Asian community loves acupuncture. It's traditional, right? So that's an added value in some of the packages that are specifically designed to give them access to it. And so it's not common stuff, but really it works when, as you said, you add that combination with the right ingredients, cleaning up the gut, doing all the stuff, and you're turning people, not upside down. You're reversing all the bad things and start kicking again or kickstarting rather their systems to operate, optimally. And really, who doesn't want that, folks? I mean, and here's the good news. I'm assuming, doctor, there's no time frame to this. You can do this at any given moment. Am I getting that right? So it doesn't matter if you're 40, 30, 50, 60, if you're in a bad point, and you can certainly make a difference and change things. And I love what you said. It's not, you work with them to make sure that the insurance and all stuff is there, and it can make a difference in people's lives, and they can have healthier, things. I mean, you can't go wrong with that stuff, folks. I mean, just think about it, right? I mean, you're hearing this. This is not sci-fi. This is real. Dr. Bilstrom does exist. He's available. He's got, people that work with him that do this.
This is the science. This is what the science tells us. It's not any one person's opinion. This is the science. And this is why whenever I do the videos like on my YouTube channel or all this, I have a scientific journal article. Here it is from the journal of whatever. This is the date, and this is what the title is. This is what it says. So people really know that, the science is clear about this stuff. It's not a bunch of voodoo. It's like, well, it's the science. Not a lot of people don't know the science. On average, it takes about 17 years for scientific data to actually start being incorporated into the medical system. Well, that's a lot of years of people suffering before it actually becomes common use. And we're trying to kind of move it forward here. Let's fix people now. Don't wait 17 years.
Well, again, just personally, I thank you for the work you do and for the mission that you've sought to actually, go after, because it is beautiful to actually know that you can make a difference in people. I'm sure you have testimonies and people that kind of like, well, you just gave an example. You were not pooping, now you're getting, nice flow. You weren't sleeping, now you're sleeping correctly. And you're right. If we don't sleep, our body doesn't. It's part of your sense, right? If
Mhm.
you don't sleep, you're not gonna have resting mode for your body to do what it's supposed to do to rest and get all, working happily. So so thank you for really reiterating that this is science. This is not, as you said, just magical voodoo business or like some you know uh side gig concept. This is the real thing. uh now I read the word epigenetics. Let's talk about
Oh, thank you.
that. You're welcome. I'm curious. I want to
I like
learn. I
you.
want
I
to learn.
like you so much. I'm more and more. I love you. You're wonderful. You asked a great question. So, and this is the other reason why women get 80% of autoimmune disease. So, we have genes. They're part of our DNA is made up of just genes, big strings of genes. So they tell the cells what to do. So we used to think whatever genes, DNA we got from our parents and grandparents. We're stuck with it, and hopefully we got more of the good stuff than the bad stuff because I see them getting stuff that I don't want, right? But it turns out it's not what genes you have, it's which ones get turned on and turned off. So there's a lot of bad genes, every cell in the body, got to turn them on. A lot of good ones, you got to turn them on. Well, all these things that drive chronic disease, they drive it because they're turning on the bad ones and turning off the good ones in every cell in your body at the same time. There's one reason why it's so easy to get one thing and then two and three and four, and you're like, holy cow, there's a lot going on at the same time. This is interesting. Well, all your cells are being told the wrong thing. So we go, okay, well, we know what drives chronic disease, what drives epigenetics, change things that change the gene expression without changing the genetic code itself is epigenetics. So meditation, Harvard did this great study 16 years ago. Meditation works through epigenetics. No wonder it's good for just about everything. That butyrate we talked about, the short chain fatty acid, that works through epigenetics too. Oh my God. That TUDCA works through epigenetics besides chaperoning mild proteins through the production process. And oh, by the way, that TUDCA kills cancer cells in a different way. It's really fascinating. So anything that flips genes the right way, you can fix kind of everything at the same time. And so women have two copies of the X chromosome. Men have one X, one Y. There are so many bad genes on the X chromosome that for women to be optimally healthy, she has to shut down at least 85% of the entire second X chromosome in every cell in the body. You have to shut down an entire chromosome almost as a woman to be optimally healthy. It's, oh my gosh, is that a lot of work, a lot more work than guys. And this is why one reason why women's health is so much more complicated sometimes than guys. But that's the other reason, besides the estrogen dominance, that women get all this autoimmune. Now, this epigenetics is what gets passed down from generation to generation. So if there's a trauma like adverse childhood events, child lives through divorce and separation and substance abuse and incarceration, physical, verbal, sexual abuse trauma, that flips genes the wrong way. It's one reason why these adverse childhood events are so good at driving childhood disease and later in life adult disease. It flips genes the wrong way. Well, if ancestors of ours have gone through trauma, they got their genes flipped the wrong way. Well, it gets passed down from generation to generation. And you hear the phrase, we're living the traumas of past generations. And it's because of this epigenetics. So ideally, in a perfect world, people don't know this. And that's why we're trying to teach them. If you can flip the genes the right way, optimize epigenetics in parents before they conceive a child, not only is the child going to be healthier, but the next 6 to 8 generations will be healthier. So we are the product of the previous 6 to 8 generations. If they had trauma and being human beings tough, they got flipped, passed it on, bing, 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 bing. And this is one reason why we think there's so much stuff going on in childhood that there didn't used to be because of all the things. So like descendants of Holocaust survivors have a lot more health issues than non-descendants. There's this thing called the Dutch hunger winter of 1944, 1945, where a huge percent of the population, Dutch population in the Netherlands were starved for an entire year. Their descendants have more health problems than other people that didn't starve. And so we're going, well, this epigenetics, we need to flip it the right way, ideally before conception. But if you can flip the genes the right way in a child before age 19, they just don't get stuck as an adult. That is preventing cancer, heart attack, stroke, brain stuff, all this But then if you can do it at the young age or before they have their own kids, well, now they get to pass on cleaner genes to the next 6 to 8 generations. And we are making, and we can optimize epigenetics in an 80-year-old, right? A 90-year-old, a 70, 50-year-old. But if we can do it before somebody has a child, we're actually making the next generation so much healthier. So we love to educate parents, let's say, including parents that have an autoimmune disease, well, let us see your kids because we know that this stuff runs in family. If you're an adult with an autoimmune disease, your kids are so much more likely to get every autoimmune disease, not just the one the parent has. It's a good example of how all autoimmune disease is really one disease that can attack any body part. We want to see your kids so they never get this stuff. But now we set their epigenetics in a good place, lock them in place before age 19. They're just not going to get stuff. And now descendants, 6 to 8 generations worth, are going to benefit from what we know we can do nowadays. And the science is very clear about this epigenetics. It's fascinating stuff, including the butyrate, the meditation, the TUDCA. Oh my gosh, these are all things that work through epigenetics.
You know, Doug, I'm listening to you, and just like my brain's like just firing up, you know, and also
It's wild. It's so cool, isn't it?
it is. Well, here's a challenging thing, right? Like, you know, everybody watching and listening probably has heard the, like, you know, this is inherited, you know, that you know, if your parents have diabetes, you might have a chance to get diabetes. If they have cancer, if it runs in the family, you know,
Right.
but no one ever explained like how it all works. This
And
is the
how you
first
can
time
prevent it. If you
and
know it, you're like,
that's
shit,
right.
I'm out of luck. This is going to be terrible. It's like, no, no, no. We can
We
flip it. Don't worry. We got the skills.
well, doctor, you did that. You kind of explain it from a real transformational and how it all happens in our genes from chromosomes and really into the deep dive. And then
Mm-hmm.
also like, hey, the good news is we can still turn this around at any given
Yeah.
age. So before you have kids, or even like if let's say you have kids, but your kids now can also be treated so they can have better progeny and therefore their kids and their, you know, next to 6, 7, 8 generations will not have these problems. And you, again, as you said, the science is clear. So this is not like, you know, you're just coming out of this, you know, with you know your own theory. This is proven. You've demonstrated. I know you gave a couple examples. I'm sure there's more, but really, it's amazing when you hear it. Like, duh. I mean, like, where? But this is the part that just annoys me. Like, where is this information? Why is it not available out there as much as it should be? You know, I'm sure that other people know about it, but it just there's not enough. You know, spread of this is wealth. I mean, this is really like how to be the best that you can be any given moment, you and your you know your society and your generations to come. So wow. That's all I have to say.
And it's so fascinating that it's not hard to do this too. You know, just doing some deep breathing, a little bit of meditation. Oh my gosh, the benefit from something that seems like ridiculously easy. The body is so smart, though. It doesn't need like a big sledgehammer to get its attention and do something. It's like you just kind of nudge it in the right direction. The body just takes over from that point on.
So doctor, someone with autoimmune disease or potential gene, you know, epigenetic, you know, bad stuff, but turns, you know, how if they came to you, you know, what would be the time frame? Like, let's say I come in with the worst scenario, and what would be like if I made some changes and using maybe a little bit of combination of all the stuff that you talked about, which these are all the elements that can make a difference. What's the time frame for someone to kind of really start seeing results? I mean, just to for our audiences, that's probably somebody like, you know, well, if I do this, how long would it take? You know, I mean, I've been so bad. What's that
Yeah,
look like?
so everybody's different,
Hmm.
right? Some people are more complex than others. But truly, the body is so good. So I'll give you kind of an example. So like here this wonderful woman, she was 84 when she came in, and she had all these health issues, including she had ringing in her ears since she was 6 years of age. And so when I was asking her all these questions about the joint pain, the muscle pain, the brain fog, the gut issues, the skin thing, her eye disease, boom, 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 I said, well, tell me about this ringing in the ears, this tinnitus. Oh, I've had it since I was 6. I'm 84. You just get used to it. It's like a 7 out of 10 constantly, but what are you going to do? I have a white noise machine at night that helps me go to sleep. And I go, okay. So we go, okay. So the science is very clear. We talk about the 7 central mechanisms that drive this stuff and what you can do to reverse it. So we said, okay, your gut's disrupted, you've developed some food sensitivities. And because you have an autoimmune disease, I know that the proteins in wheat, 62 different kinds, gluten's one, and cow's milk dairy, are bugging you in a sneaky way. They're creating inflammation days or up to a month after you eat them. That's building over time. So let's go wheat, gluten-free, dairy-free, between now and our next visit in 6 weeks. We know that we got to create some calm. That stress hormone cortisol, you got so much physical stress in your system and all this stuff, your cortisol's got stuck in the stress mode. Let's start doing a couple minutes of some kind of relaxation every day. You can pick whatever you want, but here's a free app. Just listen to it as you're falling asleep at night for 2 minutes. That's all we need. And we know that every chronic disease has an infections component, an infection. There's infections that give us obvious infections, fevers and all this. There's other infections, chronic bad bugs that drive chronic disease. So people hear things like Epstein-Barr virus, the tick-borne diseases, these other kind of guys. So we always got to use something to get rid of these infections. We use a product out of Canada that is unbelievable cool, gets rid of any infection, no matter what kind it is, no matter where it is. Just did a video a couple of weeks ago about this and oh, by the way, here's a scientific study. It actually kills malaria. That is so cool too, right? It kills everything. We use it until you feel great. So we're going to start this thing to get rid of infection. Now, infection is going to take 3, 6, 9, 12 months to go away totally. But if you start knocking their numbers down, you get some improvement. So 6 weeks later, she comes back. She's had most of this stuff for decades, right? I said, hey, so we're getting rid of infection, starting to, long way to go, creating some calm. And we got rid of a couple of foods that we know are creating some inflammation. Anything feeling better? Yeah, my energy's starting to get better. I'm starting to get a little bit better energy. I don't need a nap every afternoon. And my diarrhea and all that bloating, it's starting to get a little better too. It's not a long ways to go, starting a little better. And I think I'm sleeping a little better. And that's kind of nice. And I go, okay, that's great. Starting to get better. So tell me though, what about that ringing in the ears, that tinnitus that you had? And she stops and goes, oh my gosh. Oh my gosh, it's
Not
gone.
there.
Oh my gosh, I've had it since I was 6 years of age. And I'm looking at my notes going, yep, I see it right here, 6 years of age. That's why I asked you. And it was a great teaching moment because I was able to teach her that no matter how long you've had something, your body, the entire time it's known how to fix it, has been trying to fix it. Something got in the way. We got it out of the way. You got rid of it. But also, it's a great teaching tool. Like, you can have things, it doesn't take forever to turn this stuff around. Your body is so smart. Yeah, we have a long way to go with her, but within 6 weeks, the body was already starting to turn stuff around. Great teaching tool. Like, yeah, the body knows how to fix this stuff. Now, it can take a while to get like 80, 90% better, the big picture. Some people do it really quick. It's remarkable. Sometimes it takes a while. Kids heal better than adults. So those cute little kids from around the world with, juvenile rheumatoid arthritis, the autoimmune disease that dies, uveitis, all this other kind of stuff, they change so fast. Oh my gosh, kids are so good healers. They make a practitioner look so good because their bodies are so good at healing. But truly, you can get like 50, 60% better within a couple of months, 6 months, 80% better within sometimes 3 months, sometimes 9, 12 months. You had something around for 4 decades. That's not too bad.
Yeah, it's not bad. Well, plus, you're going to see some progress. I mean, you're going to start seeing the difference, rather quickly. But the
And
full
once
effect.
the body gets going, you may be a lot better at 1 year, but you're better at 2 years than at 1 year. And you're better at 5 years than you were at 3 years. Your body just keeps getting better and fine tuning. Even though we pulled back on most of the supplements, even though we kind of said, well, we're just going to do the lifestyle stuff now, they still keep getting better and better every year. So they feel better at 75 than they did at 65, or 40 than they did at 25.
Well, thank you. Well, so autism is a big thing, right? So
Yeah.
some of the stuff can certainly make a difference. I mean, I mean, there's probably nothing I can think of as a disease that cannot be kind of reversed based on what we've talked about today, with the right, I guess, tweaking and formulation, but I think it is possible with the work you do. Now, I have, an important question. You cannot be all over the world at the same time. Or maybe you can. How do we get to you from parts of the world, or from the US, or from wherever we are, physically, or there's a way to do this, remotely?
Yeah, so that's one of the positive things that came out of the COVID is telehealth, where we can talk to people anywhere in the world. So this is why we see adults and kids from 21 time zones around the world, every state in the United States. But what we really like to do is have every community have a practitioner that knows how to do this stuff. So we're trying to educate nurse practitioners and other medical professionals about this stuff and how to do it. Thus, I have two different levels of courses for medical people because I really think that if we're going to maybe make this the way medicine is done, there needs to be somebody in every community. And then they can teach that community, well, we know where this stuff comes from. We know how to turn around. If there's not somebody in that community, people may never hear that message, right? And so we're trying to make sure that every community eventually has an expert in this type of medicine. We're there. If you can't fix it yourself, we'd love to teach you how to do it yourself. That's why we have the courses for non-medical people. We're there for you. But man, if you have someone in your community, how easy would that be to have down the block somebody can do this for you?
So you basically grow in the system pretty much all over, and there are providers that are willing to actually take courses to learn, those practices and hopefully apply
Right.
them. Now, like it almost sounds like the naturopathic, version of things.
That's
Is
right.
that
Naturopaths do a lot of this, yeah. And I worked with naturopaths for years in my integrated medicine clinics that I was the medical director of. And I learned so much from naturopaths and all the integrated medicine practitioners. They all have something just absolutely fascinating to add to the mix. And that's where I kind of like
yeah,
I
I
got
mean,
so many board certifications and I've heard of so many different people and saw so many funky, cool stuff over the years. Putting it all together for this kind of stuff is really what I've been doing for about 30 years now.
it's funny. I always talk about martial arts, and someone's like, "What does martial arts have to do with this?" Well, here's the thing. It's funny because the art that I've been learning for the last 2 decades has a little bit of every other art in it, which feels exactly what you just said. The fact is, you kind of know a little bit about everything. You have different things. You add more things to it, and it shapes its own self in terms of how you operate in that world, right? In the medicine, I mean, that's what you're doing. You have all these, practices from different angles, and they all kind of go to the same, pathway where people can get better, can reverse anti-aging, reverse, disease and clear some of the autoimmune, problems. All of that is happening. Now, one thing I didn't touch on, or I didn't ask, is stem cells. Is that something that you delve into as well, or?
Well, this is so interesting. I think it's interesting. So the technology gives us a lot of options nowadays, and it's because of all the scientific data. But truly, there are things that maybe 10 years ago, I go, oh, we got to give somebody this, okay, because it's so important. But now we know, well, if we do things right, you can actually do this on your own, right? So ideally, every body part we're talking about, it makes its own stem cells. Well, things get messed up and that doesn't happen. Then you can't make new healthy cells. You can't replace the old cruddy, beat up cells with a new healthy cell. Ideally, every cell, every part of our body is getting rid of old damaged cells and making new healthy cells. That's basically, what's going on. So a lot of these really high technology things, you can usually get the body to do this on its own if you kind of get at these central mechanisms, including, we've learned so much about how hormones are so important, right? They keep away inflammation, they keep away disease. I kind of ran through all the reasons why a woman might want estradiol. Oh my gosh, it's so wonderful. Guys with testosterone, these other hormones. And so when we learned how important the hormones were, hormone restoration therapy became a really big deal. Well, if you can't make them on your own, you're suffering, you're moving towards disease, you're already suffering. We're going to give it to you. Here's testosterone injections, here's estrogen patches, here's estrogen creams, and all this kind of stuff. And I did that too. And boy, the body loved that. The brain loved it. People really felt so much better. But now this is so clear why this happens that we truly are in a position where we can get the body to do it itself. A guy may have totally tanked out testosterone, but we know what does that. And it does it in 18 and 20-year-olds. You see guys running down the court in high school basketball games. They're playing basketball 2 hours a day. They got a weights class and they got a tire around their middle. You can see it on their jersey. It's like, oh my goodness, you're 18. You should be able to sit on the couch eating 9 meals a day, playing video games, and still have six-pack abs, right? Your metabolism is so high, but there's very specific reasons why this happens. We do that. Guys make testosterone just like they should. Women make estrogen and progesterone all by themselves. We kind of know why this happens, but we know what to do to get the body to make it itself. So I use a whole lot less estrogen, hormone restoration, always bioidentical, always has to be bioidentical. Never want to use sort of kind of like our hormones, terrible, all bioidentical, but we don't use nearly as much because we can usually get the body to make it on its own nowadays.
Listen, I think we're gonna have to push this show out there because people need to hear this. They need to get aware of what I mean. You have the solutions, man. So for anyone that's watching, listening, or if you don't, or if you listen, please share with someone because even if you think you're optimized, you might be wrong. I mean, I think that's the problem. We all think that we are at a certain point, but you don't know what's already going bad in the body for whatever stuff that we throw in over the years. So there's a point where your body's going to start just giving up, and you start seeing some damage. Some of us are more resilient than others, and you'll feel it later. I mean, like I said, I mean personally, I've led a healthier lifestyle all my life. Yet, I know that there's pains and things that I shouldn't be having, and they're happening. So I'm addressing them, but really, like I'm folks. This is real. I'm not just saying this because it's a show. It's a real thing. I mean, I do have aches and pains like everybody else, and it did start at 50. I don't know if that's the time frame that's the magic number, but it does work that way, and you kind of work around it. Now I've beat up myself through sparring and some other stuff in martial arts, but that's not really the main reason. But really,
Right.
it's part of it, right? At least for me. But everyone is doing some sort of stuff to themselves, one way or the other. We just need to make sure that we take care of ourselves and wake up, and do something about it. And this is exactly what we're going to be doing here. So
And this is where the tests are so cool too, because you can do a lot of these things. You're making these lifestyle changes, and oftentimes, it may go, geez, it's really weird. I'm doing all this stuff. I've done my due diligence. I've read about this stuff. I don't even know if I'm getting any bang for my effort. I don't think this stuff is helping because I'm still getting this stuff. Well, what I tell them is, no, 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 you've been doing some great stuff. And when we do the blood test, for example, we're going to see things good that would never be good unless you've done all the stuff you've done. And we'll pick out exactly what you did has made great, but what you missed. But always, you've made things so good, you set this amazing foundation. Yeah, you may not be feeling your best, not as good as you got this amazing foundation. All we got to do is figure out what you missed, and then you get you over the hump, and you go, oh my gosh, that was so easy. I go, yeah, because all that stuff you were doing, it was probably helping you more than you thought. We can see it on the lab test, this foundation. We just picked out that you missed this and this, and now you're going, oh my gosh, I'm so happy I did all that stuff for all those years. Chose this food over that food, or I exercised when I really didn't feel like it in the morning. I go, oh my gosh, thank you for doing that. It made my job so much easier for all the stuff you did, and you're feeling great. And now we just got you over the hump, and you had this great foundation. You're set for a long time with the foundation you built.
Doc, do you consider yourself a biohacker? You
Well,
hear that we hear that term a lot now, right? It's an upcoming word. Like you biohack, your way around everything, right? And really kind of kick your body into super gear, right? Is that something that we can refer to here?
Well, I think the body inherently is a biohacker. Things challenge the body. Things happen you wouldn't wish on your worst enemy. The body's got to deal with it. If it's not dealing with it really great, there's got to be a reason. We should be able to figure it out, get it out of the way, and then the body biohacks itself back into health.
Well, but you're there to help it and guide it to get the biohacker. You're behind the scene. But here's a question, doctor. I think one of the main probable reasons why people may not have access is one is they go to standard medicine, which there's nothing. I mean, you do your preventative, you do your checkups a year, but I don't think that the regular checkups that you do on an annual basis will go to the depth that you actually do and the type
Correct.
of test that you were looking for. I mean, I have to say, I have my personal doctor. He does actually. We've done some deeper dive into my genetics and stuff, and like where he can see like a 10-year span of like what can be done. But not everybody does that. So
Right.
your typical clinic is not going to do that. They'll just give you a basic, A1Cs and your cholesterol, and then and that's about it. So, but really, this takes a little deeper dive on your hormones and everything to see like where you stand across the board, and hopefully, you know most of these are like 2 pages. You might probably have like 5 pages. I don't know of tests. But here's the question. Really, the reason I'm getting to this is that the cost, right? Going to a lab can cost. A lot of testing can cost. Seeing a doctor sometimes a specialty can be a higher cost than maybe going to a primary. So a lot of people may not go this way because they feel like I can't afford these things. Now, I know we've talked about insurance, and that you got specifically you work, around the world too, so you can actually guide people where they can go and get their lab work done and so on and so forth. So how does that work? Just to ease the minds of people, like, is this even affordable to someone that wants to do this?
Yeah. So I feel very strongly that this needs to be done. And I've always worked within the insurance model. There's people out there that do this kind of thing where they don't take insurance. It's all self-pay and all this. And I feel very strongly that we need to change the way this is done everywhere. And the only way this is going to happen is if we figure out how to do it within the insurance model. But that being said, maybe there's a large copay, right? And if we're going to do a blood test, well, I don't know if I can afford the copay, even though my insurance covers it, really well after I get through my copay. Or maybe I don't have insurance at all. There's plenty of people like that. And so, like with the blood test, for example, like in my book, um, we have a code in there that people can access a private room on my website to get additional information that's more than we just put in a book, right? Including, in the book we say, well, this is exactly why this happens. This is exactly what tests you run in the perfect world. This is exactly how you interpret the test results, because interpreting the test results is just about as important as what tests you run. Exactly what supplement you take, exactly when you retest, exactly what to do if things are changing or not changing, exactly when to start simplifying the regimen because now your body's taken over, and then exactly what you do to maintain it. But let's say you have no insurance, you can't do the blood test. Oh my goodness, it's so expensive. It's unfortunate, but well, we give you two different ways. You can go online and order your own blood test. Now you know which ones to do. I can order my own test. I get a printout, and kind of for pennies on the dollar, you can get your blood drawn in a lab and get your own results. So there's kind of
Wow.
workarounds here where there's always a workaround, always a workaround. If this can't happen because of this financial thing, we'll figure it out. We'll work around it. And so we want to make this accessible anyway, including you can order your own labs, pennies on a dollar, figure it out yourself. Oh, that's so cool. I didn't even need to see Dr. Bilstrom to get my labs done because he told me which one to do, and I did it myself.
Wow. Well, I have to say, I have not heard this before from any provider where they can give you the tricks to do this, off, the system where you can actually kind of do it on your own, and still get the same, results, which is that's the
Mm.
other part, right? I mean, most of us will not know where to start. But I mean, there are people that may have access, people that may not have access. And I love what you said. It is within the realm of coding and insurance, which means a lot of the stuff could be covered, obviously at a copay. But if you can bypass some of that, why not? So, and again, the reason I ask this question, because that's usually one of the biggest problems for everybody. Like, I can't afford this, that means I'm out of luck. Well, again, health is wealth. This is the best investment that we can ever do to ourselves. I mean, we can buy watches and cars and houses and travel and all that, but if you're not healthy, you won't enjoy any of that stuff. So I think the priority would be to maybe look into this and see like how I can get my body and my family 100%, and then the rest of it is going to be even better because then we can just go out in the park and have fun, and we'll have the energy to do it, and it'll be
And
fun.
you're interacting with nature, which helps cortisol, which is good for health and human health and well-being too.
Oh well, so just on that note, I mean, are you a big fan of grounding? People walking barefoot and all this stuff. So is that something that you
Yeah.
recommend?
And
Yeah.
this is where, like the interacting with nature is so important. And so with like example is they saw the people that would have their gallbladder removed, a cholecystectomy, if their recovery room overlooked a green space, they had shorter hospitalization, less post-op complications such as post-op infections. That saves the insurance industry so much money simply by overlooking a green space rather than a blank wall. And this is where you see recovery rooms nowadays in a lot of hospitals. They have like wallpaper and ceiling
Screens.
painting
Yeah,
of
yeah,
nature.
yeah, yeah.
Right when
Well,
all
even
that
some of them
data
have
came out,
screens. Yeah, yeah.
yeah, and indoor gardening, looking out the window at local. So we talk all the things we've done with nature. We teach people how to use nature to heal themselves and stay healthy, and we kind of all these different scientific studies. And I set it up like a bullseye. So the middle of the bullseye is within your own home, indoor gardening, that kind of stuff. Studies show that's helpful, right? The next one is look out your window, walk outside. The next one is go to your local green space, the little park in your neighborhood, kids and dogs and everyone running around. And then you got, forest. And then we have out here, we got national parks, right? But not everybody can access a national park. but even indoor gardening, pet therapy is nature, right? And so you can actually use nature in all different forms to get the body to heal or stay healthy by creating that calm. And the body always works better when there's a calm state generated.
Doctor, in the onset of this show, we said we have about an hour. We almost hit the 2 hour mark.
Oh my gosh, the time's flown by so fast. Holy cow, I
But
didn't realize that until you just said
I'm not done, dude. I'm not done. I mean, there's more.
that.
So you talked about the book, and now what's the name of the book, and how
It's
can people get the
called
book?
So it's called A Nurse Practitioner's Guide to Autoimmune Medicine, Reversing and Preventing All Autoimmunity. And it's really a book about the basics. And I think about this because actually, as I trained in acupuncture, I trained in Qigong, energy medicine. And so I actually do Qigong with the acupuncture to make it more effective. I practice Qigong. And like in the martial arts, is you kind of hear things like masters do the basics well. If you can't do the basics, you can't do all the complicated stuff. So that really made me think that's right. When it comes to this kind of medicine, masters need to do the basic well. A lot of people miss the basics. They may do the fancy stuff, like you referenced, like some fancy stuff, but they're missing the basics, and they're not a master, right? But if you teach people how to do the basics, they're the master, right? They can learn the fancy stuff later on, and so that's the book. You can get on Amazon, but it is written for non-medical people too, that they can use it. But because I think it's so important, people understand this is the science on this book that even is for non-medical people. I have 100 scientific references, so people can go, "Oh, that's the science." And I go, "Yes, that is." And then we have two different levels of courses for non-medical people. We have the medical bill detox. We have the autoimmune hope course. We actually have two different levels of courses for medical people, including one that gives them continuing medical education credits. So it's like they go to a conference, or they can do this and get their continuing education credits, and write blog posts. And please, if people will follow me on social media, we always post about this information, scientific studies. Typically, when you see one of the videos I've done, I'm out in nature. It's part of the
I'm gonna
teaching
stalk you,
process.
Doc.
So I'm talking about a scientific article, but I'm snowboarding on top of a mountain, or I'm, hiking or kayaking, or I'm out someplace in nature, doing these vids to kind of let people know, yeah, nature, you got to get out there, but this is a science.
Well, you know what you're preaching, and you are practicing what you're preaching, and that's the key element. I did say I'm gonna stalk you, which means I'm gonna be all over your social media, and we'll be reposting every single thing that you put out there, because I think it's just gonna make a difference. The more we push out there information such as this, it's just gonna help people. And again, that's our mission here. And I really, really, I don't know what to say, but when I got the opportunity to have you on the show, I'm like, we had our time frame was literally we're booking in the summer right now. So I'm like, we got to put this in, sooner than later, and we were able to put this today. And I'm so glad that we did, because this is not information we want to wait for months before we can share. We need the yesterday. So I'm glad that we've
Oh,
had
geez,
that
you asked
opportunity.
me to share how to access this, and I didn't even tell people about the website.
Well, no,
I
yeah,
start
well,
talking about
I'm
nature
getting,
instead.
I'm getting there, I'm getting there. But yeah, no, you're not gonna run away. I'm gonna make sure we get all that covered. So let's talk about that. The website, because you have videos, you have things in there as well, right?
Yeah, so it's drdavidbilstrom.com, and you can access all this stuff, including the over 150 different YouTube videos I have on my YouTube channel about the science behind this for kids and adults. And um, uh, the body is amazing, but it is so logical, and there's no reason why any non-medical person can't understand the logic. So it's not like, well, why don't even need to explain to somebody who doesn't know science. It's like, well, no, it's just logic. You see logic outside in nature, you see logic, and the body's very logical.
Well, folks, I mean, you spent 2 hours with us today with Dr. Bilstrom, and we've learned a lot. I've learned a lot. And what the main lesson I've learned is that we can fix our problems, we can be healthier, and it's not complex. And it can be affordable. So I think that's plenty. I mean, I think if there's a question out there, I mean, I'm a sales guy, so we always look at all these things. before you pitch, right? If it makes sense and you get the best buck, for the best bang for your buck, and you get all the stuff and you get the extra bees. I mean, I think we have all those. It's a full, 5-star here, concept. So we have all that. Um, so, Doctor, just before we close, what would be some of the core advice that you will share with our, I guess, audiences before we close the show?
Well, I'd say always remember that your body knows how to fix problems. It is trying to fix them, no matter how long you've had them. Your body is amazing, and as long as you can figure out what's gotten in the way and get it out of the way, your body can take it the rest of the way. Fantastic what the body can do.
Amazing, amazing. Well, doctor, it's like I said, a privilege and honor. I mean, I don't know what attributes I will add here, but all the others that I cannot pronounce right now will come up with. But really, it's just a great time having you with us and sharing your insights and your knowledge and your tools that we can really have accessible to others and potentially change lives for the better. And I'm sure because that's one thing. I mean, you know, you don't know who the people that you're touching, especially when you do this work. I mean, it's a lot of folks out there, and sometimes they learn something, they teach another person who really was in need,
Yeah.
and the next thing you know, that person is doing better, and you just contribute to somebody's health and lively, and a family and all the stuff. I mean, you could really turn somebody from going so bad to something, a better place, and even financially, if you can get healthy, that means you can save money. So it's a
Mhm.
win-win. So thank you so much for really doing the work you do and for being able and willing to share this because not everybody sometimes this is like I have this it's all good, people have to find me, but you're actually proactive about going out there and doing the work, which is even better. So a lot of people don't know that these things exist, but you're doing a great job about going out there and making sure that folks are out there getting it. So thank you so much. And folks, so that's it. I mean, I'm almost depleted, but I can go for another hour. I'm sure there's more stuff we can actually get out of Dr. Bilstrom here, but certainly, it's been a real, fun show, a lot of information, and definitely worth watching and listening to and sharing with others. So let's do that. And until the next time, I'm Hurricane H. We'll be talking soon. Bye for now.